Hi, I'm Dr. Sara Koehl. I'm here with Wave Physical Therapy and Pilates. I am a physical therapist, one of my specialties being in pelvic floor physical therapy. I'm going to talk to you a little bit about the pelvic floor and talk to you about how to relax and contract it. So I like particularly this activity because it's great for people who have maybe tense pelvic floors, as well as for those who need strengthening. So I'll talk to you a little bit about why that is. The muscles of the pelvic floor are situated in the bowl of the pelvis. So they make up the bottom of the pelvis here. They go from sit bone to sit bone and in between the pubic bone and the tailbone. So they sit right inside that pelvic bowl. So if you know where your sits bones are, you can kind of feel those, and knowing that the pelvic floor should contract on the inside of those sits bones and not on the outsides. That way you know if your glutes are doing the work for you or if it's true pelvic floor. So one of the exercises that I like to do to kind of get in touch with your pelvic floor is to take a rolled up towel or washcloth, something that'll give you some feedback. And you can just kind of find that area between your two sits bones here and just sit on that just to give yourself a little bit of feedback on the pelvic floor. And again, this can work for both male and female anatomy, but that can kind of help you feel where those muscles are in the pelvic floor. And then you can kind of work on taking a nice deep breath in, see if you can relax those pelvic floor muscles. And then when you take a breath out or exhale, you should be able to kind of lift those pelvic floor muscles up. So thinking like inhale, relax down, and you should feel a little bit of pressure into the towel. And then as you exhale, those muscles should lift up and away from the towel, and that's more of a pelvic floor contraction. So you can always kind of think, I like to use the imagery of an elevator. So as you exhale, that elevator goes up, and then as you inhale, that elevator comes back down. That way you can feel that movement of the pelvic floor on the towel. And again, this is a great one because I think a lot of people kind of jump to Kegels without understanding if their pelvic floor is tense or if it's weak. So this is a great way to kind of get that contraction in mind, but also making sure that you're relaxing fully in between the contractions and getting that feedback at home. So go ahead and try this out. Let us know if you have any questions or comments, and follow us in the Wave Physical Therapy channel.